Is the residency right for you? I can't answer that question. Nobody can answer that question except for you. So this video I'm going to talk about kind of how I felt like a residency was the right choice for me, some of the things that I am considering now that I'm in it, and then what I've heard from people who have gone through residencies and talking with some other people who are currently in residencies, what their thought process was and how they feel in terms of their decision to pursue a residency. And I think the most important thing is to start off, kind of like I said, the only person who can make that decision is you. There's nobody that can tell you if a residency will or won't work for you. It's a lot of self-reflection and understanding what you are looking for in your next steps after school or your next steps for clinical practice if you're already outside of school. And I know the first thing I would consider is the field of residency that you're considering going into, for sports or ortho or neuro or pediatrics, is that definitely the field that you're interested in and want to work with? Because once you go into a residency program, the next 12 months to 18 months, depending on how long the program is going to be solely devoted to that field of study and that aspect of care. I don't really see any pediatrics. At this residency, they don't make us see pediatrics. I'm not going to see any sports people unless it's for a neurologic deficit. Ortho, we do have to cover some general medical floors when we're in the hospital, so we might see some ortho conditions with that. But other than that, it's neuro. It's neuro diagnoses every day. It's neuro conversations. It's neuro coursework. It's neuro discussions. It's neuro research. All of it's focused around neuro. And I had enough clinical experiences and clinical exposure to feel confident that that was something that I'm very interested in and definitely want to continue pursuing. And, there's nothing wrong with going into a residency if you're not 100% sure, but I would at least be fairly certain that that's the field of study that you want to go into, especially if you're a student, just because you don't want to spend all of this time and all of this energy and devote an entire year plus to something that maybe you're going to find out you're not interested in. So a good way to think about that is look at opportunities you have to expose yourself to those different settings. Wait until you're kind of in the later stages of your schooling. Try and seek outside volunteer opportunities in different settings if you're not sure, because then that can help you kind of understand maybe where you might want to focus in on if you are going to consider a residency. So the first thing, consider the field of study and make sure that it's what you're interested in. So the second thing would have to be your devotion to making yourself as good of a clinician or as expert of a clinician as you can, and being willing to do that for an entire year and make PT and your devotion to study your number one thing in life. Because although, obviously family comes first and your well-being and mental health come first, but other than that, it's pretty much residency. It's your clinic, your mentor sessions, your mentor session prep, any research or any educational responsibilities that you might have, and that's it. They expect you to be, on time. They expect you to be well prepared, and they expect you to pick up on things, even if it's things that you might have only learned once, quickly. And that's because they're trying to fit as much experience, exposure, and teaching and learning as they can into 1 year or 18 months or however long the program is, to give you the best opportunity to pass the specialist certification exam the year after your residency and to make you the best clinician that they can. And they know that everyone starts out at a different place. Some people might go into a residency with minimal actual clinical experience in that field, but they're confident that's what they want to do, and they might have a little bit more room to grow than somebody who has done all of their clinicals in that field of study. But it's very tiring, and sometimes it can be a little bit daunting, knowing that you have clinic hours on top of extra learning and on top of, making sure that you're, as a new grad and a new PT anyway, doing just the basic PT stuff correctly and doing the basic PT stuff efficiently, on top of trying to specialize in an area of diagnoses or an area of specialty. And it's a lot. It is a lot. And if it's not something that you think about beforehand, it could be a little overwhelming and a little surprising. So just be willing to have that honest conversation with yourself of, is this something I'm willing to totally devote my life to for, a year and a half, or however long? And if you're not, that's okay. There's nothing wrong with it. That doesn't mean you can't try and take jobs or seek out extra learning opportunities to make yourself an expert clinician, or make yourself in a position to be an expert clinician, or seek those other opportunities. It just means that maybe residency isn't the right thing for you at this point in your life. And that doesn't mean that in 2 years, when maybe things have settled down a little bit, you can pursue a residency. But that's something that's very important to consider before going through the whole application process, which can be kind of lengthy and involved, and then putting yourself into a scenario where you might get partway through it and go, this is way, way too much for me right now, and I just can't handle it. So that's number 2. Make sure that you're willing to devote a large chunk of your life and make that your primary focus, other than the obvious things of family and self-care and religion and that kind of stuff. So I would say number 3 is talk to other people. Talk to people who have done residencies. Ask them what their experiences are. Talk to your professors. Talk to your clinical colleagues if you're already practicing, and see if they think you would respond well to a residency program. They're going to know kind of from an outside perspective what maybe your work threshold is, or what your passions are, what your drive is, or what your learning style is. And I know I talked to multiple professors about if they thought, based on what they'd seen with my learning style and kind of how they felt like I learned and responded to lectures and labs, if I would benefit from something like a residency. And they all seemed to think maybe that I would. And I felt like I would. I felt like it was a good move for me. I like to be put in those challenging situations and kind of pushed. And sometimes it's hard for us to realize or think about because we're inside of it. We're right in the middle of it. So talking to, maybe your friends or parents or other people in residencies that maybe you even don't know, so they can provide a little bit other perspective and input, and then your faculty or your coworkers, they might be able to kind of give you a look at, yeah, I think you would do well in a residency environment, and I think you would respond to that challenge well. Or, from what I've seen, maybe you would respond well from postponing residency for right now so you can get more confidence in these areas, and have an open and honest dialogue and discussion about it, so that you don't put yourself into a situation that you might not want to get into. So that's number 3. And then number 4 would just be just eventually you kind of just go for it. And I remember I was really on the fence with, do I want to do a residency? Do I not want to do a residency? Do I want to do a residency? Do I not want to do a residency? And I went and talked to one of my faculty members at Ithaca, and he was like, look, you either just do it or you don't. And you got to just make a decision and run with it. And he goes, if you feel like this is the right decision, then just make it. Don't sit on the fence about it. Make it. And that it's scary and it's a little overwhelming, but I felt like, that's kind of where maybe I was supposed to go, in that direction. And so far, I've absolutely loved it. Yeah, is it stressful? Yes. Is it overwhelming a little bit? Yes. Is it very challenging? Yes. Is there not always the most amount of time for other things? Yes. But is it super fun? Yes. Is it challenging enough that I can learn, but not so challenging that I consistently fail? Yes. So I totally love it. It's a challenge every day, but it's a fun challenge. I'm learning a ton. I feel like I'm making progress, and I can't wait to see where I'm at the end of the program, because the growth that I felt like I've made in just the past couple weeks has been phenomenal, and I can't wait to see where that continues to take me. But at the same time, I'm trying to really make sure I keep a good balance. I feel of pushing myself, and also just realizing I just need to sit down, have a beer on the couch, and watch some TV and do nothing. And I think choosing a residency program is where some of that comes into play. But I'm going to make another video about that. So those would be my four big things. Consider if it's the field of study that you want to go into, or the area of study that you want to go into. Ensure that you're willing, and at a point in your life where you feel comfortable devoting your life for the duration of that residency to a specific and defined goal and growth process and practice. 3 would be making sure that you're the type of person who would thrive and perform well and enjoys being in that type of environment. And that takes a lot of self-reflection and asking other people around you who might know from an outside perspective how you learn, how you handle those types of situations, what they think. And then I would say number 4 is, are you willing to be vulnerable with yourself and challenge yourself and be uncomfortable and get used to it and be comfortable being uncomfortable? You know, it's like a cliche saying. But those would be my big 4 things that I would consider telling people, and that I am telling people who are considering going into residency programs. I know that those are things that I considered, and some of them, you know, maybe I hadn't considered quite so much. And questions that I made sure that I had kind of answered and thought through and talked to my parents and my professors and my friends and mentors and stuff about, because I wanted to make sure that I was making the right decision, because it is a big decision. But those would be my 4 things. Hopefully you enjoyed this video. If you enjoyed this video, continue to look out for more. I'm going to keep posting videos under this playlist. I'll put a link below and up in the, I think it's this corner of the YouTube video, kind of helping people who are thinking about residency kind of answer some questions and help them make the best decision for them. So thanks for watching.